I'm so glad to welcome here today Dr. Jeffrey Nagel. He's a member of our church, and he's also the Director of Behavioral Health in Orange County. And so he's come to talk to us a little bit about stress and anxiety in this time. Thanks for coming, Jeff.
It's my pleasure. What was interesting in today's Los Angeles Times, there's an article about children's mental health, maybe the crisis's second wave. And so it is true that as we as adults are affected emotionally by this physical disease, so are our children, and children often have less resources than ourselves. So let me talk a little bit about why our emotions are affected.
So what are the emotional effects of COVID?
Well, the governor's stay-at-home order and the closure of all non-essential businesses has left many people socially isolated. They don't have the connections with people that they're used to. They don't have those connections at work. They don't have those connections in church. They don't have those connections with their children or their grandchildren or their parents. The stay-at-home order has caused us all to have less connection with others. As human beings, we are accustomed to connecting with others, and we're created to be connected. Mental health experts are predicting increases in anxiety, increases in stress, increases in substance use, increases in depression. They're predicting that we may see an increased number of deaths by suicide. And so we also know that when children do return to work, that they'll be less productive because there'll be the anxiety and stress that carries over into the school year. And we know that worker productivity for adults will likewise be affected.
So is there something that can be done to minimize the effect of that?
Absolutely. Human beings are wonderful creations of God. We are remarkably resilient. But there are things that we can do to help improve our resilience. So let me talk about those things. But before I go there, let me tell you a little bit about stress and anxiety. Stress is our reaction to an event that we view as adverse or challenging. Stress is neither good nor bad. And in fact, if we have zero stress, we actually often underperform. There's nothing like a deadline to get us to finish a paper, to complete an assignment. So a little bit of stress actually improves our performance. It's when that stress continues over time that our bodies start to break down. We can do a workout, we can hold a weight for a long time, but the longer you hold it, your muscle starts to fatigue and you're no longer able to keep that tension in your muscle. Our bodies are the same way. As we experience chronic stress, then we notice that we are irritable. We have trouble sleeping. We have fatigue. Our judgment gets impaired. We often have disorganized thoughts and an inability to focus. Our bodies are set up to breathe in and breathe out. We're able to have that tension and stress, but then we need the time to relax. We have autonomic nervous system that's broken into two branches, the parasympathetic and the sympathetic. The sympathetic is the fight or flight system. It's the one that tenses our muscle, it constricts our blood vessels, and it gets us ready to perform. But the parasympathetic is the opposite. It relaxes us, dilates the blood vessels, we relax. When we are looking to do things for self-care, we need to find that balance. Yes, we're going to have times of stress, but then we need to find times to relax. The one thing that I did want to point out is there's a large body of evidence that really shows how that relaxation actually also improves our immune system. And so in a time of a physical disease, it's important to take care of our mental health, as that also helps our physical body. Our mind and our bodies are connected.
So can you tell me how to find that balance?
Sure. Self-care is the key. So what does self-care mean? Self-care is a way of taking steps to achieve that relaxation. And the first step in doing that is to do a self-assessment. How stressed am I? Am I sleeping well? Am I drinking more than normal? Am I able to concentrate? I notice that I have tightness in my body or shoulders, or that I'm getting headaches. Doing an assessment of how stressed we are also gives us clues in terms of what we should do. So once you do kind of that self-assessment, the next step is to develop a plan for things that you will do. Plans often fall into one of 6 areas. I'm going to start with supportive relationships. It's so important during this time of social distancing not to socially isolate. Stay connected with your family, stay connected with your friends, whether that's a FaceTime or a video chat through another platform or a phone call or a letter. I know somebody who's writing letters, and it's a way that they are staying connected with others. It's important to stay connected. It's important to exercise. I know we hear that during non-COVID times, but getting out for a walk, dancing in your house, gardening, doing things where you are physically moving your body. It'll improve your sleep, but it also will improve your mental state, which does lead to sleep. Experts recommend 7 to 9 hours of sleep, and only 40% of us get that much. And so set up good sleep hygiene. Sleep hygiene is doing the things you need to get a good night's sleep. Limit iPhone and iPad before you go to bed. Go to sleep at the same time every day and wake up at the same time. Limit amount of caffeine that you have in the afternoon, if that keeps you up. Limit things that make you anxious. So if the news makes you anxious, limit the amount of news that you watch in the evening. And those are things that will help. Those are good sleep hygiene that will help you fall asleep, and then hopefully that'll kind of keep a good pattern. Nutrition is also important. So eating a good diet. When we're stressed, we tend to seek foods that aren't always healthy. High salt, high fat, high sugar. Those are things that when we're stressed, we often will reach for those things. And it's important to instead have the fruits and grains and vegetables. People who eat a diet rich in fruits, vegetables, grains, and fish actually have a 30% less chance of getting depression. So diet does affect our mental state. I put down mental and behavioral health support. Don't be afraid to reach out if you need help. And then finally, practice mindfulness of some sort, whether that's through prayer or meditation or another form of mindfulness. Recommendation is about 20 minutes a day, twice a day. There are apps like Headspace that's available. I'm actually going to be, with the county, I'm going to be purchasing over 100,000 licenses that will be available to the public, and I'll be advertising that. But that's a free meditation app that would help. There's a piece of scripture from Philippians that I really like. And it talks about how we often fill our minds with things that are not productive for us. We often are compulsively watching the news, CNN or another source about COVID, and it just makes us more anxious. Do not be anxious about anything, but in everything by prayer and supplication with thanksgiving, let your requests be made known to God, and the peace of God, which surpasses all understanding, will guard your hearts and your minds in Christ Jesus. Finally, brethren, whatever is true, whatever is honorable, whatever is right, whatever is pure, whatever is lovely, whatever is of good repute, if there is any excellence and anything worthy of praise, dwell on these things. If we're dwelling on those things, then we're not dwelling on the things that bring us anxiety.
Actually, we're about to start a series on prayer practices that we're going to offer on Thursday mornings, different ways that people can pray and center and be mindful. And so there'll be several weeks of that, different experiences of prayer together.
And that would fit in really well with self-care. So that's perfect.
Good.
So after you develop your plan, then implement your plan. There's a great resource. At the end of the video, I'm going to have a number of resources listed, but the California Surgeon General has a COVID-19 stress workbook, and it has kind of a checklist for developing a plan. Really, really useful tool, but I'll make sure that I include that. But there's 6 questions that I find really helpful that I ask myself every day. Laura, my wife, she also has those posted above her computer, and they are these 6 questions. What am I grateful for today? Gratitude is a great way of relieving stress and anxiety. Who am I checking in on today or connecting with today? So that whole discussion about social connection. What expectations of normal am I letting go of today? How am I getting outside today? And then how am I moving my body today? So being outside doesn't necessarily mean exercising, but just enjoying God's creation has its own benefit. And then finally, what beauty am I creating, cultivating, or inviting in today? And those 6 questions I try to ask myself every day.
It's a good thing that the roses are blooming so well in your garden and in mine this time of year. We get outside and we also see the beauty, and I keep bringing them inside.
Yeah.
We have a couple of members from the congregation that people emailed in to me to ask you. One of them said she'd like you to address people who have lost a mate a few months before the pandemic, and they find that their aloneness is worse during the lockdown.
First, my heart goes out to this member. Grief in normal times is difficult. And a significant loss is going to affect us. And it's really a reflection of how much we cared for the individual who has died. Our church actually offers classes on a grief support class. And there's grief support classes online now as well. And what's different about now during COVID is oftentimes people would come and give you a hug, or they would bring you food, and a lot of those normal activities where people respond to you when you're grieving, those are taken away right now. So what are ways that you can adjust during this time? I remember when my mom passed, it was kind of like wading through molasses, and I would have waves of grief where I would have times when I was doing fine and other times where I had those waves of grief. I think it's important for family members, deacons, church members to reach out, connect. That social connection is so important. But it's also important for, as you're grieving, to don't set time limits. Don't say, I should be feeling this way or I shouldn't be feeling that way. Accept yourself. Accept that grieving is a normal reaction to a loss. Remember the steps of self-care that I talked about. Those are helpful in grieving as well. They don't take away the grief process, but they help us to make sure that we are taking care of the rest of our body. We will still grieve. I find the Psalms to be very comforting, not because they are filled with joy, although there are Psalms that are like that, but there are Psalms that are just, I'm really angry. And God hears our anger too. And that's one of the things that's so reassuring about the Psalms, and knowing that Jesus prayed the Psalms as well. But there are times when we're just angry and that we're despairing and we're disoriented. And the Psalms are there. And then it's also good to remember the promises of God. God is with us. Today, Mother's Day, you preached a sermon on liminal spaces. Now, you may want to add more, but it's really that time between where we have been and where we have been comfortable and where we are going. It's that space in between where we don't have our footing. And that's where we are. We are in that space right now. But the scripture that you had was Psalm 139, and I have 3 verses that I wrote down. Where can I go from your spirit? Or where can I flee from your presence? If I ascend to heaven, you are there. If I make my bed in Sheol, you are there. If I take wings of the morning and settle at the farthest limits of the sea, even there your hand shall lead me, and your right hand shall hold me fast.
I have another question. How do you cope with the stress of returning to work, knowing that my office largely disregards the value of social distancing and vigilant sanitation? That's a question from somebody in the congregation. It's not my office that does that.
Yes, okay. I talked a lot about kind of the emotional stuff and didn't talk about the physical stuff, the disease itself. I want to, just a kind of a little bit of perspective. Orange County has, as of May the 9th, Orange County has 3,380 cases of COVID-19 and 74 deaths. We know that there is no vaccine available yet, and it'll be some time before there is one. And so the virus is out in our community. And so it's super important to practice good infection control. So what are those things? We need to wear face masks. So when you're out in the public, put on your face mask. Practice the social distancing like we're doing. Wash your hands often and don't touch your face. I had a meeting at work, and this was at the very beginning of COVID. And I said, okay, I want to practice not touching your face. And I had a tennis ball. And I said, first person that touches the face, I'm going to throw the tennis ball to. Well, and I said, and then your job, if you get the tennis ball, is to find the next person that touches their face. The tennis ball was going all over the room because we have a hard time not touching our face. But the disease comes from touching a surface that has the virus and then touching our face. It comes in through our mouths, our eyes, our nose. It doesn't, so to the degree you can wash your hands and limit touching your face, that will help. And then clean and disinfect commonly touched surfaces. So when you return to work, the same principles apply. At work, we have half of our workforce telecommuting. And so that allows more, social distancing to occur. We've also increased the number of janitorial services. So it has a Lysol smell a lot, but they're cleaning, and they're cleaning all the surfaces. I have a bottle of disinfectant that I keep on my table, at my desk, and when I'm not at my desk, I go out and I'm touching surfaces. When I come back, I disinfect my hands. Those are simple things that you can do to protect yourself. But what can this person do at work when they're not practicing these things? Have a conversation with your boss and say, what are you doing? Here are my concerns. They may be doing things that you're not aware of, or maybe they're not, and you're bringing it to their attention. The other thing to do is to say, do you mind if I work from home? I'll take these things and then I'll do these things. Ask if there's other ways to accommodate. I know some businesses where they have split shifts, where one person comes in early, one person comes in late, and that allows for that social distancing. Generally, when you're more than 6 feet apart, you're not going to shed virus so that you would get it. Even if I had COVID, that amount of distance generally will keep you safe, is what the public health experts say. So if you can maintain that social distancing at work, that'd be important.
How about those resources that you said you were going to mention?
So I'll provide a link and PDF documents that can be linked to the videographer, and we'll get that posted. In addition, I wanted to share just a little bit about what I'm doing at the county to what I call flatten the emotional curve of COVID-19. I mentioned earlier that the experts are predicting an increase in deaths by suicide. They're predicting an increase in domestic violence, both spousal and child abuse. They're predicting that when children return to school, that they will underperform because they will be still experiencing the stress and anxiety. So I have a community suicide prevention initiative that I've launched, and that is going to be reaching into multiple communities to try to address suicide, as well as knowing the signs, so that if you are a friend and you see somebody who is distressed, if you know the signs, you can make that referral. The second thing I'm implementing is an evidence-based program called Positive Parenting Program, P. And that has been shown through evidence to reduce family violence. So that is a program where I am buying, I'm trying to think, 100,000 licenses so that will be available to the community, as well as anybody who is referred for a child abuse report. That'll be a required class. It's online, and there's a full year full of support, but it will be available to the public as well if they're just interested. The youth resilience strategies, I have 2 contractors who are working on developing some distance learning curriculum that can be presented through the school districts that help develop resilience. It's based on work done by the Search Institute, but it's very research-based and is shown to improve achievement, improve civic engagement, improve a number of things, and I'm hoping that that will have a positive impact on the community. And then finally, I'm reaching into kind of the minority groups, the kind of underserved groups, because often they have less access to services. So I'm trying to make sure that I'm specifically targeting and reaching out to those groups. But those are some of the things that I'm doing to try to flatten the emotional curve.
Somebody did also ask me if she doesn't have any financial resources, is there a way to get some counseling that she feels like she needs? Are you offering anything like that?
Absolutely. Yeah, we actually extended the hours of our community counseling and support services program that offers counseling free of charge.
Oh.
And I'll provide that phone number and the link. Thank you for asking.
Oh, good. That's great. Well, thank you, Jeff. It seems like we have lots of practical things to do here. I really appreciate it. And we're glad that you tuned in to listen to this today. You can tune back in and you can listen to it again. And we hope that you'll join us on Thursdays for some of those prayer practices that we're going to be exploring different ways to pray during this time and for the rest of our lives too. Goodbye.